focused, I think, on new technologies, but I think what I'm about to tell you, to me at least, makes common sense. And so these are the three areas that I want to cover. One is interbody fusion. And I think this is the most important thing because regardless of what technology you're using, regardless of what cage you're using, I think surgical technique is probably the most important. And no matter what they develop, there's going to be no substitute for surgical technique, whether you're doing an A-lift, T-lift, PLIF, an MIS T-lift, or an endoscopic fusion. If you don't have good surgical technique, then it doesn't matter what the technology is. You're not going to be as successful. And vice versa. If your technique is not so good, maybe some of the technologies might give you a little bit of an advantage, but I think you have to focus on surgical technique. When you're doing any interbody fusion, and again, I think people want to hear about all the new technologies, but for me, it's like you got to do a good disc prep, right? Clean out as much of the disc as possible, and the more minimally invasive you get, the less amount of disc you're going to be able to remove. And then not only cleaning out the disc, but having enough space to have the biologics in the disc space, and then make sure you perforate the end plate. You know, a lot of people forget that the Smith-Robinson technique, the anterior cervical discectomy infusion, actually had very poor healing rates until they burned the end plates. And then they started having good fusion rates with autograft bone, historically, right? And so when we think about it, just giving those end plates, preparing them, making sure there's good bleeding cancellous bone, that was the factor that turned the ACDF into a very highly healing surgery. And prepare the end plate, size the implant appropriately, make sure there's good contact area, you get the biggest cage that you can get in there, and then use the right graft material and fill it as much as possible, because you can overcome the biological properties of the biological product you're using by giving more volume. But again, it doesn't matter what BMP you use, what biological product you use, if you don't have good surgical technique, it may not heal. I always say, think globally when you're thinking about these types of cages. And I always give an example to my patients. If someone offers you a car and they say you have two choices, you can have the Ferrari or you can have the Hyundai. Which one are you going to pick? Well, of course, you should pick the Ferrari, but if you think focally and not globally, you might pick the Hyundai. Because if all you're worried about is how much money you're going to spend on gas, you're going to pick the Hyundai. If you're going to say which is better for the environment, you're going to say Hyundai. Which one makes less noise? It's the Hyundai, right? But clearly you should pick the Ferrari. And so that's what I'm saying is think globally. You can't focus on one thing. So expandable cages. I love expandable cages. What does everyone say is the negative about it? Well, it's going to subside, especially in poor bone, right? But that's like the Ferrari versus the Hyundai. I've actually altered my practice with expandable T-lift cages. I'm not doing as many laterals, I'm not doing as many front backs, because if it does subside, it kind of locks the cage in, right? And you know you're getting through the end plates, but for me, it's an easier fit, especially minimally invasively. I don't have to make a big opening, retract the nerves. We just heard a great talk on neuritis. You don't have to retract the nerves as much, and it kind of locks it in. And you get more lordosis, you restore the disc height. And so for me, I love expandable cages. I think that's a great new technology, but everyone always kind of sits there and says, well, they're going to subside more. And I would agree with that. But again, that's the Hyundai versus the Ferrari. The second thing I want to talk about is fusion assessment, because when we're looking at all these new technologies, we want to get better fusion. But can we really judge a fusion? Now, if you look at Dan Rue, he critically looked at how we judge a cervical fusion, and he has this very strict criteria, right? If Dan Rue says it's fused, I'll believe him, because he has all these criteria right here, right? But when you look in the literature, especially at these new technologies, they say these are fused. And for me, I don't know if this laser pointer works, but for me, I still see a cleft here. For me, I wouldn't say that those are fused, but these are published results that people are saying with these new cages, they're saying these are healed. And I'm looking at their papers and I'm saying, I'm not sure I would judge that healing. So whenever we see these new cage technologies for interbody fusion, whether it's cervical, lumbar, whatever area of the body, we have to say, can we trust the literature? Because when we're doing these new titanium cages, can you tell me if those are healed? I can't tell, right? Can you tell me if this is healed? but they're saying titanium is better than PEEK, right? So in a sense, obviously we have to take the literature for what it is, but if we can't really trust the literature as far as judging a fusion, because I've seen papers where I just don't believe that they're healed, then can we really trust the literature? And that's the other thing, is that no matter what technology you have, unless you're confident that it's fused, you may not be able to say that it's better. And that's the problem, right? And there are so many other variables. We talked about independent of the cage, your disc preparation, things like that. Are you using instrumentation? Is it a standalone anterior? Are you using screws in the back that will give you a more healing rate? What biologics are you using? Using autograft, allograft, using BMP, maybe using BMP off-label. You know, that will make a determinant, right? So there's so many things, and you know, when you sit there and say, well, use our cage because it's the newest technology, you know, you can't really know unless you do post-mortem, you know, histological sections to know whether those cages are better. And so the last part is novel technologies. And so I do think that there are some advances. And obviously, I think if you look at the literature, the titanium cages seem to have better healing, better osteointegration than the PEEK cages, which are kind of inert. And then when you look at some of the coatings, they probably increase the rate of healing. But I think I would sit there and say, I'm not sure that that will make the difference between a fusion and a pseudoarthrosis. Because the cages we use, unless it's a big A-lift, the cage is kind of small. And whether you have a few millimeters, micromillimeters of bone integration into the cage, now that can give you a little bit more stability, but unless you have columns of bone fusing through the cages, or around the cages, or in the center of the cage, it probably is not going to be strong enough to really be a solid fusion. And so if you look at the literature, I did want to include some, and I won't go into the details of this for the interest of time, but obviously if you use a PEEK device, it's probably not as good as titanium. There's a lot of basic science and animal studies showing that titanium activates the osteoblasts better, it probably has better biological activity, and you know, maybe biologically the titanium cages are better. But in the end, I can't really judge and see whether a titanium cage is integrated. I can see if it's failed. I can look for the absence of failure. I can look at loose screws. I can see loose cages, lucencies around it. But I'm not sure I can judge whether a titanium cage is healed. And this is some of the literature. I'm happy to give it to you. But in the interest of time, I would say that I'm excited about the new implants. I think titanium is better than PEEK, and I think the PEEK coatings are probably good for better integration. So in summary, I think the most important thing is surgical technique. I do think there are advances in cages, and I want to use the most biologically active cage that I have, but there are so many other factors that we have to consider to get a successful healing. Thank you very much.